Of the findings is going to be very wide, and youth will be one of many audiences that we want to share the findings with. But a part of the analysis itself will be for the data collectors and also members of the All Partners group to actually look at the data and help interpret it. That will be key. And I don't see any barriers to younger people being involved in that. And in fact, we could even think about internships, because this is data analysis and they could get some skills. Right. So I think that might be an easier way, because of the AmeriCorps rules and because of IRB rules, it might be an easier way to incorporate the young people.
And maybe even to help get their input to inform what goes on and implementation. You mean as well? I mean, just the design, the concepts of how to reach out to kids and youth, and how best to go about that.
My guess is the first thing they'll say is, why didn't you talk to us? And we have some answers about that, but I think we will need to talk to them.
And give them some ownership.
There was also a conversation way back when we were talking about this. There's another big study going on that's primarily focused on that age group, that's asking some of these same questions. So we felt two things. One is not to be duplicative of that, but also to involve three things: to involve them in the ways that we've talked about here today, and then three, I'm glad you brought it back up again, because I hadn't been thinking about, or we had collectively, thinking about another phase in which we may focus just on that age group. You know, I'm just making it up because we haven't decided, but maybe get their perspectives on assets. But because of the difficulties, we need to separate it out.
So who's spearheading this?
We have. That's what I said. I'm glad you brought it back up, because I hadn't thought about it in a while. I forgot. Nobody's done anything on it yet, but it's certainly something. If we feel now is the time, we could pull together a group, or maybe wait. It's up to us. It's really up to us.
Ma'am, did you mean that other study?
No. Well, I think that's important for us to be able to look at that data and see exactly how they conducted it.
There are several of us involved. We could easily arrange a presentation of the preliminary data at one of these All Partners meetings.
That would be great. I just think there's also, we've mentioned ways that we want to incorporate them, but who is actually spearheading that? That's where we're actually moving toward that. So that was a question.
Ernest?
And now I realize, because Chris said it had been a while, but the last time we spoke about it, because I know that you had been away, and it was because you had gotten sick. And the last time we spoke of it, you were actually present at those meetings. And we had not really gone back to it, because we've just been trying to just get to this point where we can feel like we're going to do something. And so now we're here. Now we can circle back and begin to deal with some of those other issues that we know is going to exist or arise. That being one.
So is a reasonable first step then to maybe, Nan, as you suggest, have a little presentation based on the other data, then that can help us think about how to perhaps...
The timing on that study, those data will be ready. So we're moving, this is moving forward.
But the qualitative?
Yeah, but
okay.
It's the quantitative data that's, I think.
Does it?
So I think the timing on it is such that we need to move this forward, and then we can see how that youth piece connects.
So is that, everybody okay with that? I mean, we're not going to leave it alone, but maybe we've got some good momentum. We're very close. We've been working on, let's get this up and do this, and then come back to that and focus all of our attention on that.
I just have a question. So the student enrollment team, is that only for Hopkins students, or were we thinking about youth?
We were thinking broadly about youth, and it just became very challenging to find, as an example, I'll give you one example. If you're talking about students of different kinds, and let's just focus on Hopkins for a minute, public health, medical, nursing. They're in school at different, their semester periods are different, their availability, and sort of figuring out how to really plug them in into a process like this. We're going out in the field, we weren't able to figure it all out. So that part of it is that. So we have to, but we're committed to involving them in some way, and there's interest but it's a struggle to figure out all this.
Okay, I just wanted to clarify if that was inclusive of community youth. when
It
we
is,
were talking about
we just didn't honestly get a good way to figure it
Okay,
out.
well, yeah, because it's not, I mean, really, it's not gonna happen overnight.
Right.
You're talking about recruitment and you're
Right,
building
I'm
trust.
glad you brought it back up, so we need to start thinking about it again. Okay. So anything else, any other questions about the positions? We're moving pretty rapidly. Please, 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 if you have any availability, let us know. All right. And I guess we do have people from our group, maybe some not here tonight, but some here. If you, I guess it's appropriate if you've applied that you're not a part of the process, right? You shouldn't be interviewing people if you haven't. All right, so next thing is update on training for the data collectors. Liz alluded to it a little bit more. I don't know, is there anything else you wanted to say about that, Liz?
I don't know if any of the teams have anything to talk about for the training.
Oh, that's true. So we've been talking about this throughout all of the work groups, sort of what pieces need to be trained on. And so maybe if there are representatives here, if not, I can fill in. And you want to talk a little bit about the methods and what they've been thinking?
Sure. At the methods committee meeting, our responsibility for the training is to actually train on the protocol of the research. So a lot of what we'll be training on is administrative. How does a potential person to be interviewed get put out? How does an interviewer receive that assignment, if you will? And how do the audio files and all of that? So we'll be doing a lot of the technical pieces. Another piece that we'll probably do is some human subjects training for the institutional review board.
Could you just explain what that is for people?
Yeah, the institutional review board is a board that exists at every institution that does research, and the mission of the IRB is to protect human subjects. And they evaluate the human subjects procedures of any research study that's being done. And there's two aspects that's relevant. The first is that our study has to be approved by the IRB, which is something that's in process. We've already received a designation of not very intense review because we're not collecting names and we're not putting drugs in people's arms and the kind of thing that requires very intense scrutiny. But they still will look it over and comment on our consent procedures and things like that. The second piece that's relevant about the IRB is that the people who are collecting the data need training in the rules and regulations. So for example, just one example is that if the interviewers have to, on the one hand, assure people that what they say will be held absolutely confidential and be familiar with how what people say will not be connected to their name. That's one thing, and there are some exceptions to that. If a person expresses an intention to hurt themselves or some other people, then the interviewer has an obligation to do that. And in this project specifically, there has also been a component where if the interviewer is made aware of an emergency medical issue, we are going to have a procedure to refer the person with the issue to care. So that will all be sort of trained. And probably the biggest technical thing will be simply to train on how to keep the names of the people separated from the data, so that we have the names and we know who we have in order to make sure the interviews happen, but that those names never get attached to the data when the person actually goes. So that's one. Did I do anything else? Oh, effective. The active listening.
Active listening.
Yeah, the methods team put out a request for bids for training in attentive, respectful listening, because that's what we want our interviewers to do. And we got one request and we've accepted that, and so we will be contracting with a person who will do about a day, I guess? 2 days of training on active, respectful listening and techniques for that, because This is not a survey like where there's very specific questions and you have to get the person to answer that specific question. And that sometimes is how it has to be, but this is not that kind of study. And so that will happen.
Ernest?
And just to add to what Nan is saying, the training for the interviewers is kind of like what we do here. Someone asks a question and then there's a lot of feedback and interpretation from the group as a whole and from the individuals that are speaking. And so that is the hope, that is what we're trying to achieve with each of the data collectors as they're being trained, so that we aren't going through this list of questions making some people feel quite intimidated and possibly miss what we're after. Instead, we just want to be able to have a conversation with people, allow them to talk about their communities, about the people in their communities, about the things that they feel are important, and not try to lead them to some particular place or events that we know may have existed, but this person just doesn't care about it because it's not important.
Great. So that's the methods team. They're going to be teaching about sort of the technical end of things. We also have the emergency response and intervention team. Anybody here from that group? Well, I can fill in for them. So they have been thinking over the years of just that. Well, we would go back way back to the beginning when we first started talking together about this. We heard from community members like, okay, we get the need to do an assessment, but let's face it, we know some stuff. We need to be fixing some stuff and in the process. And so one of the things that we agreed that we would do is find ways of addressing real issues that are in the community. We had a work group formed around that, that's the emergency intervention and response group, and they conceived of 3 levels of intervention, 3 levels of things we can fix. One are, if we're going out in the community, we may well talk to people who have emergencies. Actually, it could be I feel chest pain, or I feel like killing myself, or I feel like killing somebody else. You know, it could be a variety of things. But we need to be trained and be able to know what to do to handle those situations. Not to say, oh, you better go see somebody, but to help get rid of that problem and get them in the hands of the right people or whatever it takes. So there's emergencies, and that's largely called 911. But then there are urgencies, things that are urgent problems, but you're not going to die within the next few minutes or potentially if something happens. And there are 3 or 4 things in there. And then there are, the last level was more general sort of health education things, which we said we can't really do well in this context, but maybe through incorporation with the activities of the urban health and the ongoing activities, different lecture formats or conversations or whatever, we can integrate some of those things in there. And there were some specific topics in there. Long story short, they've developed training protocols for those things. I mean, I won't go through them all now, but they've definitely been working on that and done that. So everybody who goes through, and you know, we've talked about in the past offering these trainings in 2 contexts. One, to the people who are actually going to be doing things, but if possible, also at a different time, offering them again to anybody who wants them in the community as a capacity building exercise. Because some of these things are really skills that can not only help you personally, but may increase your marketability for a given job or something like that. So that's something else we need to think about exactly how to do it, but we have talked about doing that in the past. So that's the intervention team. Let's see, student and community involvement, that's another one. A lot of talking about what they should do. What it's been whittled down is to. I'm sorry,
I can talk about it.
Oh, good,
Yeah.
wonderful, good.
Since I'm working on it. We have a couple of sessions that we've been planning, and one of them is the history of Baltimore and Hopkins and the relationship there. And so Stephen Ragsdale from the Armstrong Institute has a presentation, and then we're working on how to make it more participatory, especially to involve some of the experiences of the interviewers, since a lot of them hopefully are from Baltimore. or will be from Baltimore. And then the other session would be a panel of community leaders who are from the zip codes in which they'll be interviewing. And so that's what we're trying to look at. So
Bob?
pretty cool.
So one of the things you may be aware of, but maybe not, and not in lieu of what you're proposing. So on July 16th, there was a panel that Stephen Ragsdale was part of, and Adrian Mosley and Bishop Douglas Miles and Ralph Moore, all of whom grew up and lived in East Baltimore, on many of those issues. And that was recorded. There's a video of that. And so you might want to think about how that video
Yeah, that's a good idea.
incorporated into our.
Yeah, that's a great idea.
Yep,
Is it posted anywhere, Bob?
Sorry?
Is it posted anywhere other than your office?
No, it's not in my office.
Oh, okay.
It is posted on, I'll say it, but then I'll tell you I haven't checked.
The
Okay.
plan
It's posted on the source.
We're not sure if it's there.
Okay.
Could you check, Elizabeth, on that? Because there were we did 3 sessions. And the third was this past Monday, and the gentleman to my left was one of the 3 panelists. Major Russell was talking about the transformation team. Sarah Heminger was talking about the incentive mentoring program, and Newborn Ministries was presented by Todd Marcus. So that's looking at 3 examples of community-driven interventions and supports and programs. So we'll check, and I think that would just be very good to send out to all of our network the link so people can see that.
Yep, yep. Let's see, is there another group I'm missing off the top of my head? Is there another group I'm missing? Communications. We talked finance. Finance didn't really have anything to train on, except, can you give us more money?
Which is
So what we're thinking of is this training it will be roughly 40 hours worth of training. That's not just 40 hours of lecture, but practical experience, practice training. I mean, I don't know.
And it probably will be over 2
That's what I was going to say. So it'll be spread, 40 hours worth of stuff spread over 2 weeks. There's a few more things to put in there, like conflict resolution, those kinds of things, so that, because we never know what's going to happen when we're out there, and we just don't want anybody to be safety and those kinds of things. But that's basically the structure and makeup of the.
And all the positions will undergo the same type of training?
Everybody. Yep, everybody. And that would start right after we hire folk. Yeah, for the first 2 weeks of August, last 2 weeks of August. Right. And then we'd be ready to go on the field right after.
One of the things that we discussed at the most recent methods committee meeting, vis-a-vis training, is if he can do it, we would coincide the all partners meeting at the end of August with essentially the end of the training, because it would coincide. And we would invite Jody Kreitzman to come. Some of you may remember Jody because he's been here twice now over the past year and a half working with the All Partners Group. And he was engaged very much at the beginning. And the thought is that he would come back at the end of August to really talk about where community assets building that's being done here fits into really a whole movement, and that people are doing something unique in Baltimore, but it's really part of a big thing. And then we would also do this and have this link with the partners meeting at the end of August. So,
Yep. And have a real ceremony for those who
Yeah.
successfully completed,
Yeah,
getting
so-
a certificate of completion.
We'll get back to you on that. I need to, it was only in the last few days that we had a sense of the timing of when the training will be on, so we'll follow up.
Any thoughts, questions about any of that, the training or any of those things? Okay, all right, if you have any, or if you have burning passions to be involved, let us know, or that kind of thing. So I think those are the major updates about the community health initiative. Are we missing any, did we forget anything, Liz, that you can think of? Okay.
Day-to-day, and report out from Ernest's presentation.
Oh, man, yeah, I wanted to do that at the beginning too. Ernest, you want to tell us what it's about, and then Ernest tell us how it went.
This project got an invitation from Baltimore Day-to-Day. Was anybody at Baltimore Day-to-Day?
I was, he did a great job.
Yeah.
We got an invitation to present some data, and so Ernest stepped into the breach and agreed to present for us on a panel about the use of data in the study of the city. And I was out of film, but you want to tell us how it went? And I believe there's video.
Yes, there will be video. Amy, there's actually two. Amy did one, so that one will actually end up on either the CHI or UHI website. And then Baltimore Day-to-Day also is going to do a video did video, and they're supposed to be putting it up on their website. The event was pretty good. Thank you, Edie. Thank you, Amy, because both of them were there, so I actually had, if I was going down the wrong path, at least I had two cheerleaders in the room. But it went pretty well, and there was a lot of questions, and a lot of questions around what we were doing, because there was a lot of interest in what we're doing, how it's being done. Unfortunately, there was not a lot to dig because we're still at the beginning phases. But a lot of the questions actually focused on what are the implications and the impact that what we're doing can have. And even to my surprise, you realize that this is a big thing that's going to have an impact, that it will help hopefully change some lives. But the impact there was a lot bigger, and there's a lot of people became interested. I didn't have business cards, so I think I gave out about 3/4 of the cards that Amy had when she came, and we were just passing them out to people to contact her. We also had to put the information up regarding the website, also tonight's event, as well as some other information about the process so that people can contact the organization, contact us about getting more information about the community health initiative. Did I miss anything, Edie? Because you were there, and I love it when others are there.
Ernest was like a celebrity out there. All right, so he really was, and I thought it was really good in a sense, and we talked about this, of that presentation being a recruitment tool to get additional partners here at these meetings. And so prayerfully, we will begin to see to see our numbers growing with others. I mean, because they all just really kind of rushed to him. And I said, great, we have some more partners coming on board. So that was good. And they were all service providers for the most part. Who were, the room was packed, which was wonderful. It was at UB. And the room was packed. So it was about, I guess, two layers of auditory in one of their classrooms. There was not an empty seat. I think I took the last seat when I got there. So they were primarily service providers, which would be great partners, and they would complement all of our group.
What were they interested in? Were they interested in being a part of it, or interested in getting the data? Interested in what?
They're interested in both.
Okay.
So there's actually an interest in both.
Okay.
One, because we have not done the data collection, a lot of them were interested in the data collection
Right.
and about the assets. But then what we're going to, once we get this information, what it is we're going to do. And although the slides provided limited conversation about the health assessment, one of the things that people showed a great deal of interest in as they talked to me was our mapping. Because within the maps, we were talking about doing the layering and how we would do zip codes, layer in assets, layer in health issues, and then be able to look at that. People thought that that would be good because now it provides an opportunity to see what the problems are and also see what the needs are and where the gaps are. Because, as Edie pointed out, because many of them were service providers, they can now look at this area of East Baltimore and say, okay, here are some problems, but these assets are not in place.
Right.
Let's see how we can move to try to fill those gaps in.
Great, great. Excellent, excellent. Good. Anybody else? Comments, questions? Thanks so much, Ernest. And it's my hope going forward that more of those things will happen, not just with Ernest, but anybody else who's involved in this process. Well, the only other thing I have on the agenda for tonight, so it looks like we're going to get out early, is the Day of Hope that's coming up. And I don't know, Melvin, if you want to just say a few brief words about the Day of Hope, so everybody knows.
Yeah, so for anybody that's not familiar, this is I really think it's a beautiful collaboration, more importantly tangible from the community's perspective. Because this is where the churches, the businesses, the police, the community, we all come together to turn around and service the community, so they absolutely know that somebody absolutely cares about it. So we started these last year. We just did one. The last day was July 30th in Collington Square Park. And if you remember, that was on a Saturday. That Friday, the storm hit and knocked everybody's power out. So we lost a lot of volunteers, but we still had about 225 show up. They left their homes with no power, and they still serviced the community. We had about 13 residents come out, and they were absolutely well received, well blessed. So it was great. What happens is we feed them while they're there. So it's just a 4-hour block, 12:30 to 4:30. So the one coming up Sunday. It's Saturday, 12:30 to 4:30. We'll be at William C. March. We chose this. I decided to go to William C. March this year because too many tragic things have happened in that community. That's the community of Darley Park and also South Clifton Park. And a lot of you will remember these two names. Monet Turnage was the young lady just this past year who was a wonderful girl, wasn't involved in anything questionable, any risky behavior, was about to go skating with her friends. Was in one of the friends' house in that community, and one of the brothers, or one of her friends, male friend, went and found the brother had a gun in the house, started playing with the gun and shot her in the chest accidentally. And they just panicked. The kids just panicked. They're 12, 13 years old, dragged her into the alley, tried to conceal her body, and removed her again, dragged her down the alley, just put trash on her. The sad thing is, was don't get out of this room. She had been alive and probably would have been safe. She was alive for quite a while, but finally just succumbed to her injuries just because they panicked and got scared. So the church was packed. I went to the funeral that day. I was fortunate to speak at that funeral, so it was a really moving service. A wonderful family. So what we're going to do is honor that family for the loss of their child Saturday. The year before that, almost to the day for the anniversary, you may remember another young man by the name of Sean Johnson. He was 12 years old, football star. He absolutely was a mentor to even older kids in the community. This kid never got in trouble. He just so happened he was playing basketball with some of his friends. None of them were bad kids. Earlier in the day, and on that same basketball court, there were a group of drug dealers also playing. And it just so happened a robber group drove by and saw that group of drug dealers, and they wanted to take them out. So as they often do, they went home, got their guns, came back, drove through the neighborhood, saw these good kids, because it looked like they were all together, saw these good kids sitting up on a porch, now watching NBA Finals and just ripped the porch up. So shot all 4 kids and ended up killing Sean Johnson. Again, another tremendous kid in the community. He was definitely going to be something. So we could also honor that family. So what happens is there's only 2 types of people that come to these events. You're either volunteer or guest of honor. I always say I don't care if you could be the governor, the mayor, you could be the president coming through. Yes, you will be a guest of honor. But you can also be somebody who has to report to jail Monday morning and start serving your sentence, and you will still be a guest of honor. We treat everybody the same. We respect everybody, and we just love them while they're there. We have a tremendous kids zone. It's probably the most popular thing we do. It's about 12 moon bounces. We have a puppet show set up there. All kind of games for the kids to play, whether they're a lousy game player, lousy hopscotch, hula hoop person, they're going to walk away with prizes.
We'll get the helicopter this year.
We'll talk about that. So you know, everything. There's nothing they can buy. The community can buy. You know, the kids come and get their faces painted up, and they just have a great time. Free cotton candy and popcorn. The kids just love it. I just love to hear the laughter of them just running around. Because listen, these are Powers kids. They don't get out. They don't get a chance to see anything like this, so they just have a great time. And then we have a stage set up, and we have a lot of local talent. We've been blessed to have some real artists. I say real recording artists come through because they hail from Baltimore. They just heard of something, or they knew somebody that knew something, and they came in and asked could they be a part of it. So, you know, we said, listen, you can be a part of it, but you're not getting the dollar. It's all volunteer. And they get up on that stage and they sing their hearts out or do whatever they do. But we also use local talent because we want to be able to give a platform for our local youth and other people in the community. As a matter of fact, I just met a young lady about 2 weeks ago, has a beautiful voice. So I immediately recruited her. I told my sound man, I said, listen, we don't have space. She will open us up. So she's going to open us up with the national anthem, and then she actually wrote a song, and she's going to sing that song, at which time we'll let everybody continue the event. So there's all kind of informational booths set up. Now, we are great. So we great. So Hopkins will be in the house with the health piece. So we'll have all these informational booths set up, everything from how to expunge your record, how can I go from a renter to be a home buyer. Of course, there's a health fair. It's just a plethora of things. On top of that, we give away free haircuts. Barbers walk away from their barber chairs, which is tough on a Saturday. But we get them to walk in and cut hair for free as long as they're there, as long as we have a line. And there's always a line. Come get your nails did, ladies. Hopefully no guys, but we come get your nails did. Not knocking if you get manicured. But it's just a tremendous day, and literally these families come in, and they literally, lots and lots of them go out crying. You know, because one of the things we did, you can't leave there without us piling you up with more than you can carry groceries. And a lot of these families don't know where they're going to get their next meal. They just don't know. We give you a quick testimony, then I'll shut up about this. We had a family, I remember we had a family come in, and they just had nowhere else to go. They just came in, decided, you know what, let's just cast our cares away and come in here. Father was unemployed, mother couldn't find a job, wasn't sure how long they could keep their places, they were facing eviction. By the end of that session, the mom we had gotten her a resume typed up, shot her over to the employment place, because we have some employers there, she got a job. Then we shot her over to our clothing bank area, gave her 5 brand new suits. That Monday she was starting a brand new job. And so she literally, because she came to a day of hope, she literally saved her family. And the husband, all he could do was just cry and say thank you. And then we told her we're not done yet. We just gave them as much closer as we could. And they walked out of there. So that was a life-changing event for them. So we're excited about this, and I'm just looking forward to it. It's an exhausting day, but it's really worth the reward. So if you can come out, just please be a blessing. I have a few surprises this time, and you have been tremendous in that. I've been trying to get a couple of Ravens. Unfortunately, they're on lockdown for the entire week. They can't leave the hotel. I've been trying to recon them out, but I just can't. I can't get them out. I can't get them out. But I did sneak some footballs in. I just gave one of my coworkers about 30 footballs, and they're going to take them up to the hotel, and they're going to be signed. And I'm going to give those away just randomly to some of the kids that's out there. So it should be a really fun event. So I'm excited about it.
I want to, I can't add anything to that, but these
are
amazing.
And the helicopter, I'm sorry, the helicopter couldn't make the last one because of the storm, but I just saw them today. They promised they will land. And what we do is the kids don't never.
Ernest wants to go.
He may make the weight requirement, so he may not. But all we do is we put the kids on there because they've never seen it close up, and it's just wonderful. They shut it down, they land, and they just get to play with not too much, but they play with the control, and you just see the smiles on their face because they're inside this helicopter. So it's a tremendous day for the kids and all of the families.
It really
I'm
is.
sorry.
No, I was going to just reiterate. I think I heard there was about 2,500 people showing up to one of the big ones last year. So it's grown from the 13 to 2,500, and everybody gets a bag of groceries at least. This is what it's, in my book, this is what it's all about. This is why we're doing what we're doing. So if you can come out and you can support it, we're going to be there, and please support it. And the last thing, anybody else thoughts or comments?
We have another update. At the last meeting, And I know, actually Amy's not here, but Ann Langley reported on the CMS grants. And there was a subcommittee formed. Do you have any update on that?
Yes.
We,
Yes. What, you want to hear it?
I would like to
There was a subgroup formed. I know that Ann has met with Reverend Debbie Hickman and Leon Canal last week. The Hopkins group, let me back up. The original proposal, which was went in for 30 million, was funded at 20 million. But they never revised the text of the proposal. And so what they're doing now is, because we talked about circulating the proposal, and they were concerned about it because they said that it's no longer the accurate proposal. So they're revising the proposal, and the plan is not to consume a lot of the All Partners meeting, but to come back, and then Ann and Hunter Young, who has been here before, will come back in a month from now, at the August meeting.
so just to make sure you understand, the government said, we'll fund you, but instead of giving you the 30 million that you asked for, we're gonna cut 1/3 of that off to 20 million, just under $20 million. So now you have to make what you used to think you had 30 million to fit into that, so things are getting reshaped. We haven't seen that yet of what it looks like. There's a negotiation process that we hopefully all of us will be.
I think it's important also to mention that Chris has been asked to be very involved, not just marginally involved, very involved with, in terms of the community health worker, no, I think that community care coordinator component of this, and so he is.
Let me just say one thing, Bob. My way of operating is to be honest and upfront. So I have to tell you one little thing. $20 million, even though it's expecting 30, that's a lot of money, right? So a lot of people have their hands and eyes on this money. And they are not playing to lose. I don't know everything that's going on, but I have been asked to be a part of it. So I'm fighting for you, but I don't know how it's going to settle out. I just want to be honest with you.
So I appreciate you saying that. I think that that's true. So whenever there's a big deal like this, and there are a lot of people who were invested in the 30 million, their hands are into the 20 million. And there's less obviously there. The easiest group to shortchange is the community. This probably isn't stunningly shocking. But there are some very hard-nosed conversations, and our role, and Chris is directly involved, and my role is as an agitator to really we'll find out, but to really say not only will this not fly, but if it were to fly, it undercuts what you wanted to accomplish in the proposal, which is really the bottom line. Where there is going to be push and pull, though, even if we cross that curve, also to be very clear, there are 500 hands from Hopkins in that pot. There will be 500 hands from the community in that pot. And the only decision rule that should be used is what is going to accomplish what the promise was of this project. And the promise was to be able to help those who are the most complicated patients, who use and have Hopkins as a revolving door because they don't have a support network that is a community support network to build that. That's the core of what this is about. There are other pieces too, but that's the core. And so I think that what I'm arguing for and what we're arguing for is you have to look at what the goal is to achieve, and then you build around that. I'm optimistic that it will be a new way of doing business. I can't guarantee it. Part of what makes it more complicated, very honestly, is that there's some new players at Hopkins. There's a new dean of the School of Medicine. I mean, when I say new, I mean 2 weeks. 2 weeks that he's been there. And so, you know, this ain't Iowa. He came from Iowa. And so he's on a very steep learning curve. And it's a little more unpredictable. But so that's the longer story.
I mean, it's funny because I guess the bottom line is always the dollars. However, that's really not where the update is great, but your update really focused a lot on whose hand is in the pot. I do find it very interesting that you noted that and met with 2 members of the CHI. So I think for us, it's a very pivotal time for us to use this to look at how we move forward when we look at activities for the CHI. And then also what was decided at that last meeting and how we bring that back to the group. Because if we create a subgroup that's going to handle this, and then we come back, I'm one of the members of the subgroup, and then there are also community, I work for Hopkins, so at least I'm fine. But I'm thinking about the community members who signed up to be in that subgroup, and they're never contacted. And then it kind of,
subgroup are you referring to?
the subgroup that was created at the last meeting to help iron out how that community piece looks of the
I
grant.
missed that, but I know what you're
So
talking about.
it wasn't absolutely solid, but I
Yeah.
think what Bob brought up is great because there are people in the CHI who are looking at how the community piece looks and how we interact. Then there are people looking at how can I get money out of it?
Yeah.
And that needs to be clarified,
Right.
even with our
Absolutely.
partners.
Absolutely.
All right, so that's something, it can't be just,
Yeah,
you know,
no,
can't be ignored.
we agree, and let me let you comment, and then I'll say a quote.
No, I just had a question. I'm new to all this, so I'm trying to figure out what it is. What is CMS, and have they dialed back the deliverables to reflect the being 20 million instead of 30?
So if I could, in a nutshell, the Obama administration allocated $1 billion, not all,
Yeah, right.
for developing models of care that improve outcomes and reduce costs. Okay, so that's sort of the core. So the target, this is a hospital-driven and medical system-driven grant application that was targeted for the highest cost patients. The highest cost patients aren't those that just have hypertension. They're hypertension, diabetes, they are drug users, they have depression, they use alcohol, they have no family, they come into the hospital, they get patched up with the same quality medical care that everyone else does, but then they go back into where they were before. And so the question then is, if you're going to change the trajectory for that group so they don't keep coming back and coming back, what do you do to put in place? That's really the challenge that Center for Medicaid and Medicare Services has laid out in their grant. So the proposal that went forward, the other thing I would say is that in the request for proposals, there was a mandate for a very strong community participation component. the hospital came to this group and said, will you sign on? We had a lot of conversation. There was a commitment that was made. So now, and that was originally at 30, it was then cut. They said, you have the grant, but it's 20, and this is fairly recently, in the past 6 weeks or so, that, so they're in the process now of thinking through, how do you deliver it, and what is it that's the $20 million product versus the $30 million product, et cetera. So that's, for those who weren't having to do
And
it.
it's
That's
straight
sort of
from the feds, and it's not going through the state.
It's not going
No.
through the state. This is a federal award, federal competition.
Anybody else? Any other questions? So as I and Bob, and we learn, you will learn, and be involved in the fight, but it will be a fight. Yes, right.
And, because I don't know how many who were at those original meetings with Hunter and the other gentleman who were.
Costas, look at.
Costas, yes, were the principals who showed up. But somewhere in there, there was a community component within the grant itself.
That's right.
But then he also mentioned, sorry, but I always remember somebody tell me they would give me some money. And there was a second component in there, because one of the things that we were talking about was community infrastructure.
Right.
And one of the things that they talked about was that Hopkins would need to do an investment in conjunction with the grant, with the grant if they won.
Right.
And they saw this added money that would come directly out of the hospital as a way to also feed back into this group to support this group. But we did not, and they said that as they knew more, they would come back and have that conversation.
That's right.
And so I'm really concerned at this point now that I hear, because I kind of figured there was going to be a number of hands chasing after the 20 million, and maybe we could skip off with that part that they put on the side there.
Well,
So
here's,
we can find that.
all of this is related, right? It's not as though this is over here and this is over here. And some of the factors that Bob brought up, the main one being the new D, complicates everything to an unbelievable degree. Because, you know, you bring in a new top guy, and I'm not saying anything has happened. I have no knowledge of what has happened, but I'm just saying, he can come in and say, well, this is how I want to run it now. And then you have to start the process all over again and say, not only this is what was promised, but this is what you need to accomplish, and at the same time show how we can help you do it in a way that doesn't cut us off and we get nothing, they get nothing, and nobody wins anyway. So it's a very complicated process. But we're still in the vote, and there is not only a mandate that the community be involved. I will say that some of them really recognize they need the community involved. Everybody doesn't share that view, but I know there are some that do, and so that gives us an opportunity. So, but we will let you know as we know. We will fight with and for you, and we will be successful together. All right? Anybody else? Any other thoughts, questions?
The funding and sustainability team, any updates with that?
No real updates from that team.
Any more space for membership?
There's always space on money. Matter of fact, you got money in here? Sure, I can get your name. You
David
can.
Skinner with the Coalition and Childhood Level.
Excellent, excellent. All right, David.
And also, sure, I want to find out if there's any more space in the Day of Hope for vendors.
We'll find you. So you are now chair of the funding committee. Thank you all for coming. We'll see you next week. Next month. Sorry, wait, one last thing. Here's a to-list. If you can be involved in the Days of Hope, sign up here. And another t-shirt. Yeah, we got brand new t-shirts for everybody. Take the t-shirts, start wearing them at our event. Are they all the same?
No,
Oh, you have to sign for them? Oh, where did they sign?
So just sign in,
Make sure you sign in so we know.
Are they all one size or are they variable sizes?
Okay, we got mediums and we got large.
Great.
Very proud. Thank you, sir.
There's another large.
Yes.
Yeah, you can go back.
Anybody else need a large?
Yes.
I will speak one more. And everything. We also got bags for you if you want some tote bags.
Because it's been a long time since we skipped this we skipped this one.
Jerry King.
Just go, there's a volunteer table, so
That's good. At least if we have one or two people on each
Well, good, well, I'm glad we.
Yeah, this is
When is the deadline? I guess you guys know what we want to say.
Yeah, well,
first one.
technically we don't have, we make like, well, it depends, we don't technically have it.
That's right, that's right.
But we do have a program that.